Welcome to our live stream and podcast, Viva Lleg Latino and Emigrare. And yeah, usually all the programs in Spanish, but now it's in English because we are happy because today we have a program. And I hope you enjoy by a minister who has already been with us on different occasions. So I invite you want to watch other interviews we have in our program and our platform. But for us, it's very emotive have the Honorable Minister Adriana Lagrange, Minister of Health in Alberta since June 9, 2023, and Mariluz Ingbritson to co-host in this program for Viva Lleg Latino and Emigrare.
Pleasure to
Hi.
be here.
Hello, it's a pleasure to be here with you guys.
My pleasure as well.
Minister, thank you for being part of the Viva Lleg Latino Emigrare platform. Can you give us an overview of the current state of healthcare aid in Alberta, please?
Healthcare aids or
No, healthcare. Sorry.
healthcare in general.
Yeah.
In Alberta. Well, you know what? We do have some challenges, but we're looking to address it. I am fortunate to have one of the largest budgets in all of Alberta. $26.4 billion is in my budget. And so something that I announced very recently was the Modernizing Alberta's Primary Care System, which is really looking to stabilize and keep the workforce that we have, keep those good doctors, nurses, and nurse practitioners and pharmacists, etc. Keep there in Alberta, but also add new ones in and encourage more people to come to Alberta and take those much needed positions. We do have some stress in the primary care, primary care is where you can go and have a family physician or someone to deal with your day-to-day issues. Of course, if you have an emergency, you go to the emergency department and into a hospital, but we need a strong primary care so that we can keep people well and outside of the hospital. And that's our focus. We want to build a strong foundation for primary care. So that was an announcement I made last week. And we're going to work on recommendations that came through various panels that we had. We had a big engagement last year right across the whole province. And so what we heard from those groups, recommendations came forward. We've got some short-term recommendations that we're acting on right away. And then we've got some medium and long-term that we will continue to work with.
Hearing that as music to my ear. As a nurse, I am an RN, and I would love to see more the overhead care system start working better. I concentrated all my life for 20 years in the senior sector and the community sector, and I have been working with seniors for years. And I have seen a decrease in those programs. How the government is prepared to help those seniors that stay at home, to stay at home, but have a proper life, like a human being, and and have a recreational life, because those programs have been cutting for many years. And I think it's time that we can give them something back.
Yeah, and I agree that we have to do better, and what in that vein, we've actually added almost $2 billion over the next 3 years to enhance our programs, particularly in continuing care. We know that seniors do better if they can stay in their own home longer. And if they have access to home care, self-managed care, so they can pick and choose what they need to help them, have the ability to have family members and others come into their home, provide supports, but also when they need to go beyond their home, what are the other opportunities they have, whether it's a small group home type setting, is there anything that we can do before that? So we brought in new legislation in the spring. We're working on regulations to enhance that legislation. And I think there's more exciting things to come on the horizon. We know it's going to take investment, and that's why we've made that big investment of $2 billion over the next 3 years to look at how do we as you say, give people dignity, that they can age with dignity. And I'm a mother of 7. I'm a grandmother of 8. And I had the privilege of journeying with my elderly in-laws as they aged. And some of the things that they faced, I want to see fixed. They had been married 64 years, and yet they ended up in their final years, months in different facilities. And that's just not right. We need to keep couples together who want to stay together. And so there's so many different things that we can look at. And so I thank you for being a nurse and for the excellent care that you give. I know we have incredible nurses, doctors, healthcare professionals right across this province. And I want to thank all of them for just really caring and doing what they can to ease the discomfort of so many people.
I going to talk about the nurses program. Our nurses programs have been very diminuted because it's so many steps to go now into nurses program. We are in a deficit of nurses and doctors. What is the government is willing to do to set with education and help us out to get nurses in those programs, because it's very congested, the program for the nurses right now, and it is a tons of step. The nurses now, person like me, I went 25 years ago for nursing, but the programs are changing so drastically, and it is so hard for many healthcare aides, for example, they have been doing this for years, to get into the nursing programs, like LPM, RN, and all those programs.
So we're working with the post-secondaries, with the different universities and other post-secondaries, because even some of the polytechnics have abilities to have degree granting status. So we're working with the post-secondaries to look at how can we streamline those programs and make them more accessible. Through the Ministry of Advanced Education, they've added more seats. Over the last couple of years, actually, we've added, I think, 10,000 more seats right across the province, mostly in healthcare professional areas, because that's where we are seeing a lot of need. And there's some other areas where there's a need as well. But mostly in healthcare professionals. I know that Minister Sawney just last week announced additional money for bridging programs for internationally trained nurses, that when they come here, they can do a bridging program so that they can, become more accustomed with what we have as protocols and things that have to be done here in Alberta. And we also are working with the College of Nurses to streamline the process of registration, so that nurses that are coming from other countries, other provinces, nurses that are underemployed here, that maybe came in, took a healthcare aide job, but now want to work to their full scope as a nurse. Maybe they were a nurse in another country and came, and then so those opportunities, they've streamlined the process. So my understanding, like even in the months of June and July, typically the college registers about 500 nurses a year, and I believe in those 2 months they registered 3,000 nurses. So we're opening up pathways. Is it perfect yet? No, but we're doing a lot of different things to try and reach many.
I think it's very important that you explain that to us, because in the community, I work with tons of healthcare aides, and those healthcare aides want to become a nurse, but the process to screen to go to that bridge from nurse to LPM is practically impossible if you don't have a certain certifications. The college actually doesn't do it. They say, no, sorry, you need this, you need this, you need this.
Mhm.
And sometimes you got the knowledge and you got the experience, but you cannot jump that. And I know say that you should jump at it, but I think we have a lot of qualified healthcare aides here in Alberta that we're able to go to the next stage.
Yeah.
But
Mhm.
sometimes those steps
Yes.
actually say, you know what, I better stay like this.
Yeah.
And we actually need to encourage those people, to encourage them, say, you know what, yes, it's a process. This is what you need to do, and make it easier for them to go, because there's a lot of qualified, great healthcare aides out there that would like it to become an LPM or RN, but the college, the bureaucrats of the college sometimes doesn't help them out.
And that's
Yeah.
what we're working with the colleges and with the post-secondaries to really see if they can't look at that very issue. How do we encourage people to move to that next level? I know many LPNs who want to go on to become registered nurses, but they have young families, they have commitments. How do we get more bridging programs? Because right now there's only one bridging program.
Yeah.
How do we expand that across the province? So those are the things that we're looking at as a province, as a government, to really, give people more opportunities. When healthcare aides go on to become LPNs and nurses, and then nurses become nurse practitioners, that's great for our province. But that means that we'll need more LPN or more healthcare aides too.
Exactly.
So then
Yeah.
we'll have to make sure. And the other piece is we have to recognize that they need to be funded appropriately as well. We have to make sure that they get a good wage so that they can provide for their families also.
Absolutely.
Minister, Alberta has a very diverse population. We are a multicultural. How does the healthcare system meet the unique healthcare needs of the province, different communities and cultures groups?
Well, we really try to make sure that when we have various groups where we see concentrations of groups, that we do address their needs in a culturally appropriate way. And I'll give you an example. Particularly, we have a lot of Indigenous people in Alberta, and we know that while on reserve, yes, it is a federal jurisdiction. We also know that we have to do everything we can as a province to make sure that we are looking after all of our citizens, including Indigenous citizens. And so part of the MAPS process that we went through, we had an Indigenous panel that really specified recommendations for that group on how to deal with getting rid of racism within the healthcare profession. We're looking at a $20 million Indigenous communities innovation fund so that they can design and deliver their own healthcare services. We want to encourage more Indigenous individuals to become doctors and nurses and nurse practitioners and pharmacists so they can provide healthcare to their people, because again, then you have that culturally appropriate healthcare system that really meets the needs of the individuals. So we try and break down barriers. We try to, when Alberta Health Services puts out information, they try to put it out in various languages, depending on what area they're in.
Minister, what is the specific and immediate action is the government taking to ensure that Albertans are available to access and receive the primary care?
Well, as I said, we just released the reports on the Modernizing Alberta's Primary Care System. There is also an Indigenous vein to that. That was after a lot of consultations. So some of the things that we're doing is we're creating a primary health care division within my department. There's never been one. So what we see right now is very fragmented. It's a little bit of this, a little bit of that, but no coordination. So we need some people to actually coordinate. We're allocating $57 million over 3 years to provide family doctors and nurse practitioners with support to manage their patient numbers. Really, it's around the administration piece. We're also really creating a pathway for nurse practitioners now to have their own patients panels of patients and providing funding to them. So this is very different. Nurse practitioners can do mostly everything a physician can. They can see patients, they can prescribe pretty well everything except for surgery. So this gives us more capacity. There'll be more people able to see more people that don't have doctors, family doctors, because we know there's a shortage within the province. And really right across Canada, I heard that. So there's a lot of many steps that we can do. I was with the ministers of health from across Canada and PEI just recently, and everybody was saying the same thing. There's a shortage of nurses and doctors and healthcare aides, and how can we all work together to solve these issues?
What is your experience in this event with another Minister of Health in Canada, Minister? Can we talk a little about?
Well, you know what? It was a great experience because we create relationships. And we all have common problems, and we see doctors and nurses that travel to and from each other's provinces. We have patients that sometimes we actually provide service to the Northwest Territories. We have an actual agreement with the Northwest Territories. We also have, specialists here in Alberta that they don't have in other provinces, that people come here to Alberta for certain things. So I think, it's great to have those opportunities to get together, because then you realize you're not alone. You're not the only one that has issues trying to get a family doctor. We're seeing that right across Canada and really right across the world. There's shortages of anesthesiologists, some specialty areas. So it's easy for us to get together and, say, okay, how can we do things better together? And also it gives us a voice to advocate to the federal government.
There have been a lot of buzz about Alberta healthcare being privatized. What does that mean for us, for Albertans?
Alberta healthcare will not be privatized. It never has been privatized. It never will be privatized. We exist under the Canada Health Act. We function under the Canada Health Act. We make sure that every insured procedure is completed and you don't have to pay out of pocket for that. I think people get confused because right now, any doctor that's out there, a family doctor, most of them have their own practice, and that's technically a business. They run their own businesses, their own clinics, and so that's called a public-private partnership, where we as a government fund them to actually provide service. So Albertans never have to worry about paying out of pocket for items that are insured. There's under the Canada Health Act, there are areas that aren't insured, sometimes like, certain, procedures that plastic surgery, those type of things that are maybe more cosmetic. Those things sometimes are insured, sometimes they're not. So non-insured, that's different, but on insured things, you never have to worry. Alberta is not going to privatize. Are we going to look to make things better, more efficient, get better results? That's my job, and I take that very seriously. In my mandate letter, I am tasked with how do we use that $26.4 billion more effectively and more efficiently and get people better service, because right now people are waiting too long to see a doctor. They're waiting too long to get into an emergency room and seen by someone. They're waiting too long for surgery when they need surgery, and we need to fix that.
Minister, what is your vision for the future of healthcare in Alberta?
I envision healthcare in Alberta being a leader in all of Canada and in the world. We have incredible gifted, talented doctors, nurses, healthcare professionals in general. We need to celebrate the great things we're doing. The one thing, I've only been a minister for about four months, a little over 4 months, but we are leaders in so many areas, and we need to celebrate that. But we do have issues that we need to address. and some of those things that I mentioned earlier on surgeries and on hospital times, wait times to get into a physician, the number of areas and access for some people. Rural, remote areas need more access. There's a lot of issues we need to address, but we also have to celebrate all the great things. And what I want to see is Alberta becoming a leader once again across Canada and around the world.
On healthcare.
On healthcare, because we have the best healthcare. We will again have the best healthcare available.
Minister,
so
what is
my goal?
Absolutely. Minister, what is the message for the Latino Canadian community that see or listen to this podcast interview, Minister?
Well, thank you to the Latino community. I really appreciate everything that you do. My parents immigrated from Italy back in the 50s, and I know what it's like to come to a new country. And I just want to say Alberta welcomes you. Thank you for choosing Alberta. You didn't make... I would say you made a good choice, not put it in the positive. You made a good choice, and we are very committed to making sure that we have the best healthcare system available. So thank you, and thank you for being an Albertan. So thank you.
Thank you, Minister.
Well, thank you for all the stuff that you give us. You give a lot of information that is important to us nurses and to the community, because a lot of times we see the news and the news actually put it a little bit the spicy on it. That we're getting like what is right and what is wrong, what is the true and what is the not.
Yeah.
You are clarifying a lot of points that many of us Albertans and in the Latino community, we are worried about it. It's okay. How is this going to work for us?
Well, and I look forward to coming back. I know there's going to be more initiatives, and so I hope you'll welcome me back to explain and
absolutely
to share more as more comes available. So
absolutely,
we have is the first, but for sure not the last time we are with us, Minister. Thank you so much for taking time to talk with the Latino community, and see you until the next show. Take care.
Absolutely. Thank you so much. Have a great day. Bye-bye.
Bye-bye.